Okay, so since this is a vulnerable and diverse populations course, one vulnerable population that I wanted to highlight was health disparities that LGBTQIA populations face. Looking at this population in the US alone, 5.5% of all US adults identify as LGBT, and that's about 13.9 million. So LGBT is an umbrella term which includes a number of different groups that can either be about sexuality or gender, but some of these groups include lesbian, gay, bisexual, transgender, queer, intersex, asexual, or questioning. And this statistics comes from the 2020 to 2021 Behavioral Risk Factors Surveillance System. And however, most LGBT plus adults are significantly younger, with almost 2/3, 62%, between ages of 18 and 35, compared to 36% of non-LGBT adults. Some of the health inequities that LGBTQ experience are all throughout their stages of life. So, various studies have found that LGBTQ plus youth and adults are at a greater risk for suicide, suicidal thoughts, mood disorders, depression, anxiety, and eating disorders. LGBTQ have higher rates of substance abuse, including tobacco, alcohol, and other risky behaviors. LGBT adults are more likely to experience chronic diseases such as HIV, AIDS, obesity, cancer, and heart disease. And then lastly, LGBTQ adults are less likely to have health insurance, seek medical care, receive quality care, or fair treatment. So the question that came to my mind was, why does this population face such severe health disparities? And as much as society is working to overcome homophobia and transphobia, there's still a delay within healthcare and healthcare delivery. One of the main forces that drives health disparities today is the discrimination, mistreatment, lack of cultural competency, and institutional bias in the healthcare system that still exists. There's also a lack of education and training for healthcare workers serving this population. Additionally, some of the health disparities relate to lack of insurance coverage and lack of the knowledge about this population. And lastly, there's still a lot of violence and victimization related to homophobia and transphobia. The health disparities of this population are also under-recognized and under-acknowledged in the medical community. So the reason that I wanted to talk about this was to really just bring awareness into this population in the health disparities that they face. Thanks for watching.